Maharashtra man who returned from South Africa tests positive for Omicron, India's fourth case. India has reported two more cases of Omicron variant, taking the tally to four. The third case was reported in Gujarat and the fourth in Maharashtra. India's first two cases of Omicron variant were reported in Karnataka. Meanwhile, single-day rise of 8,603 COVID infections have pushed India's COVID tally to 3.4 crore. Union Health Secretary Shri Rajesh Bhushan chaired a high-level virtual meeting with the states and union territories to review COVID-19 public health response measures and preparedness amid reports of Omicron variant of COVID-19 across various countries. Here today, in the presence of Dr. V.K. Paul, Member Health, Niti Aayog. The meeting was attended by Shri Rajiv Bansal, Secretary MOCA, Dr. Balaram Bhargava, Secretary Health Research and DC ICMR, Dr. Sujit Kumar Singh, Director NCDC, State Health Secretaries, MDs, NHM representative from Ministry of External Affairs, Bureau of Immigration, State Airport Public Health officials and other officials from the states and union territories, reiterating that the revised guidelines and international travel advisories of the Union Health Ministry in view of the new variant of COVID-19 have been shared with the states. Union Health Secretary advised the states not to let their guards down and keep a strict vigil on the international passengers coming to the country through various airports, ports, and land border crossings. The states were specially advised to undertake effective surveillance of international passengers, enhance testing, strengthen the testing infrastructure, and strictly implement the testing guidelines. Steps to ensure ample testing in each district while maintaining RT-PCR ratio. Effective monitoring of all hotspots, effective and regular monitoring of home isolation cases, ensuring augmentation of health infrastructure, coordinate with APHOs and Air Suvidha portal, daily monitoring by the state surveillance officer to track and contain the spread of transmission of any VOCs in the country, especially from any recent cluster of positive cases. DGICMR informed that the Omicron variant does not escape RT-PCR and RET. Hence, the states were advised to ramp up testing for prompt and early identification of any cases. States were advised for target or prioritized testing of passengers from countries not at risk as a part of the ramped-up testing by the states. Continued need for further vaccination coverage, adherence to COVID-appropriate behavior, and need to avoid mass gatherings have been stressed upon. Bureau Report, Hallabol.